Lumacaftor, Ivacaftor in patients with cystic fibrosis homozygous of PHE 508 DEL CFTR. Background: cystic fibrosis is a life-limiting disease that is caused by defective or deficient cystic fibrosis transmembrane conductance regulator CFTR protein activity. PHE 508 DEL is the most common CFTR mutation.
To improve the trans
in lung airways and passages in other organs. Cell surfaces have tiny proteins called CFTR. These act as channels for chloride ions to regulate the movement of salt and water in and out of cells. In cystic fibrosis, this process is disrupted because of a mutation or error in the CFTR gene, which provides the instructions for making CFTR protein channels. As a result, thick, sticky mucus builds up in many organs. Some CFTR mutations can cause what's called a gating defect, where the CFTR protein channels are present at the cell surface but fail to open correctly. Kalydeco is designed to keep CFTR protein channels at the cell surface open longer to improve the transport of salt and water across the cell membrane. Indication and important safety information. Kalydeco is a prescription medicine used for the treatment of cystic fibrosis, or CF, in patients aged 6 years and older who have a certain mutation in their CF gene called the G551D mutation. Kalydeco is not for use in people with CF due to other mutations in the CF gene. It is not effective in CF patients with 2 copies of the F508del mutation in the CF gene. It is not known if Kalydeco is safe and effective in children under 6 years of age. Kalydeco should not be used with certain medicines, including the antibiotics rifampin and rifabutin, seizure medications, phenobarbital, carbamazepine, or phenytoin, and the herbal supplement St. John's wort. Kalydeco can cause serious side effects. High liver enzymes in the blood have occurred in patients taking Kalydeco. Regular assessment is recommended. The most common side effects associated with Kalydeco include headache, upper respiratory tract infection or common cold, including sore throat, nasal or sinus congestion, and runny nose, stomach or abdominal pain, diarrhea, rash, nausea, and dizziness. These are not all the possible side effects of Kalydeco. Patients should tell their healthcare providers about any side effect that bothers them or doesn't go away. Please see full prescribing information for Kalydeco at www.kalydeco.com.
Ivacaftor, a CFTR potentiator in patients 12 years of age or older who has cystic fibrosis and were homozygous for the PHE 508del CFTR mutation. In both studies, patients were randomly assigned to receive either Lumacaftor in combination with Ivacaftor or matched placebo for 24 weeks. level groups. Among patients who receive Lumacaftor, Ivacaftor, and some
Hi, my name is Felix, and I have cystic fibrosis.
Hi, my name is Fiona, and I have cystic fibrosis.
Hi, Charlie!
What is cystic fibrosis?
Cystic fibrosis, or CF, is a genetic disease. That means we're born with it. When we are born, our genes determine our eye color, hair color, and if we look like mom or dad.
A defective gene causes our bodies to create a really thick mucus that covers our internal organs, especially our lungs, making it hard for them to work correctly.
Is it only you two who have CF?
No, there are 30,000 people across the country and 70,000 worldwide who have CF.
What happens to you when you have cystic fibrosis?
Because the mucus is covering our lungs, it makes it hard for us to breathe. We can do everything you can do. It just takes us so much more energy.
Can you give your CF to someone else?
No, cystic fibrosis is not contagious. You either have it when you're born or you don't.
You don't look like you have a disease.
On the outside, we look like all of you. But on the inside, our organs are working overtime. All the time. Just to function properly.
How else is your body different because you have cystic fibrosis?
Well, we have to be very careful not to get sick. When you get sick, you might be in bed for a few days. When we get sick, we can end up in the hospital.
The mucus inside our bodies holds on to the germs and bacteria, making it very hard to get better. Sometimes we can be in the hospital for months.
Is there something you can do to stay healthy?
We try to keep our lungs as clear of the mucus as possible.
We do this by putting on a special vest several times a day that shakes us to loosen the mucus.
So we can then cough it up and spit it out.
To keep healthy, we also have to take medicine every day. Lots of medicine. On average, we have to take 40 to 60 pills a day. That's 350 pills a week, and 1,500 a month, and 18,000 a year.
If you were to stack a year's worth of pills end to end, they would reach 750 feet tall. That's more than halfway up the Empire State Building.
Wow, that's a lot of pills. How can we cure cystic fibrosis?
Right now, there is no cure, but scientists are working hard every day to find one.
And there are lots of people who are helping by donating money so the scientists can keep looking for the cure. But for now, every time we blow out a candle
or wish upon a star, it's for one thing.
A cure for cystic fibrosis.
Cystic fibrosis is a genetic disease that alters the body's respiratory, digestive, and reproductive systems. It affects the body's epithelial cells that comprise the lining of the lungs, pancreas, liver, sweat glands, digestive tract, and reproductive system. Normally, the epithelial cells release a slippery layer of mucus, captures dust and germs, and acts as a lubricant. A person with cystic fibrosis inherited a gene that causes the epithelial cells to produce a defective protein. That protein leads to the formation of thick, sticky mucus, which causes many serious problems. The sticky mucus can clog the bronchial tubes, interfere with breathing, causing coughing and wheezing, cause fatigue, interfere with digestion and absorption of nutrients, which can limit growth and weight gain and cause chronic diarrhea. Common symptoms of cystic fibrosis include persistent coughing, poor weight gain, bulky stools, and very salty tasting skin in infants. Treatment of cystic fibrosis varies according to the stage of the disease and which organs are affected.
Cystic fibrosis is a genetic disease that you're born with, and it affects your lungs and your digestive system. Every form of it is kind of different for everybody. The logistics are the same. Sticky mucus forms in your lungs, and it contracts your airways from breathing. So I take a lot of medication to make sure that I thin out my mucus to help me breathe better. I was diagnosed when I was 2, so I was a baby. But you're born with it, so the first 2 years of my life they didn't know what was wrong with me. On my 2nd birthday, my mom found out that I had cystic fibrosis, and she immediately started talking to people, other parents, got involved, and tried to figure out how the best way to handle this for the rest of my life. It is my life. For so long I didn't think it was. I lived a normal life. I played sports, I went to school, I had tons of friends, and I lived life like I didn't have cystic fibrosis. It wasn't until I was older when it really became real that I do have this. But I think the reason I lived such a healthy life is because I lived life like it was. I didn't focus on the fact of being different or anything like that. I think that I lived life differently than other people. It's led my life in a positive way, though. I think the reason I do what I do, if it's business or cheer for the high school, or if it's my daughter or my husband, I do what I do because I know that I'm a little different and I have different things to worry about. 16 was a kind of crucial point in my life because I think it was the time when you were told you weren't going to make it past that. And I fell in love with my husband at 16. I also learned that don't wait for somebody to give you the green light, because you'll wait forever. Depending on who you talk to, a lot of people say they couldn't play sports, they couldn't work because of a lot of treatments during the day, and that was never an option for me, ever. So I played basketball, softball, cheered. I was on 3 teams at a time. And the minute I came out of high school, that's when I started my business. And there was like no stopping me. You're not telling me I'm not doing something. It's just not an option. It wasn't an option in my house. It wasn't an option for me ever. And I try to really teach the kids that. That's kind of why I do this. You know, it doesn't matter what people say. Nobody has like a stopwatch on you. Don't let anybody here tell you you can't do something. It's really exciting because they're so close to a cure. This past year I just got involved with doing a walk for CF. I never really got involved with anything like that because I was so busy kind of doing my own thing. And then seeing where cystic fibrosis is going, and they're so close to getting a cure, that I felt like, again, I have to do something. So we did a walkathon, and I raised, I think it was like almost $5,000 my first year, which was huge for us. I'll never forget my doctor when I was little said, by the time you're an adult, we'll have a cure. And I believe it. I totally believe it. Don't be quiet about it, and don't be shy about it. A lot of kids with CF are like embarrassed because you have to take so much medication when you eat. Breathing treatments that really aren't very glamorous. I mean, you're breathing in stuff to get mucus out of your lungs. Sometimes you have sick days, you have bad days, but pretty much like do what you have to do. Do not miss your treatments. And again, don't let anybody tell you you can't do something. It's kind of changed a little bit. I had Emily 2 years ago. She'll be 2 in January. So her, I would say her. Because, you know, I want to be a good mom like my mom was, so. And that takes a lot of work for me to be here, so. That's my job. It kind of shifted from just me and my husband to me, my husband, and Emily. But they're really my responsibility now. So I got to take care of myself, I take care of them. That's kind of how it works.